Walk in love as Christ loved us and gave himself for us an offering and sacrifice to God. These are familiar words to us, offered at the beginning of the Eucharistic prayer on Sunday morning. Walk in love. We have been walking through this pandemic now for about 18 months, and it has been most difficult to walk in love. We are tired, anxious, worried, and many of us have lost loved ones. We have disagreed about how best to confront this pandemic and have sometimes quarreled about the validity of wearing masks or even taking the vaccine. And yet, we are bound together by the love of Christ, and walk we must, even with those with whom we disagree. As the Delta variant causes a surge in cases, many are seeking guidance regarding worship and fellowship. The diocesan office continues not to impose mandates at this time, but to offer the following cautionary advice and recommendations. Since the transmission rate of the Delta variant is at its highest in every county in our diocese, and since only a few counties have percent positivity rates below 10%, the watchword is definitely caution. This means that church leadership, along with their health equity teams, should be continually assessing the safety regarding worship. Because the situation is volatile and changes rapidly, decisions should be reassessed each week. To guide your decisions, we offer the following recommendations. When indoors, wear masks. The wearing of masks will reduce the risk of contracting breakthrough COVID and will protect the unvaccinated, particularly children. Singing, if done indoors, should be by masked individuals only, and congregations should consider limiting the number of verses of each hymn that is sung. Service times should be shortened to 30 to 40 minutes, particularly if singing is part of the service. Adequate ventilation should be attended to, and if possible, outdoor worship is safest. Physical distancing should be observed. Continue to avoid physical passing of the peace. Communion should continue to be administered in one kind only, or with individually prepared containers. There should be continued effort to offer technological alternatives to in-person worship, such as live stream services, pre-recorded services, or services on Zoom. And now, a word about the vaccine. While there is much political debate about the vaccine, the purpose of my communication to you today is not to engage the debate, but to offer the following information. According to data posted on the Virginia Department of Health website, persons who have not received the vaccine are 3 times more likely to contract the virus than partially vaccinated people, but are 13 times more likely to contract COVID than fully vaccinated people. And among the fully vaccinated population, 1 in 500 develops a breakthrough case of COVID. Only 9 in 10,000 are hospitalized, and only 17 in a million die. These data suggest that the vaccine offers protection against the virus, not only in terms of protecting folks from contracting the disease, but in mitigating the effects of the disease that might cause hospitalization and or death. So, let's keep walking. Our journey through this pandemic will one day end. Our commitment to each other and to Jesus, however, will never end. So while we are walking together, let us walk in love.